Imagine starting your day feeling completely normal, just like anyone else. You wake up refreshed, stretch, and look forward to the day ahead, ready to take on whatever comes your way. But as the hours pass, something changes. By midday, your eyelids begin to droop, your smile becomes uneven, and even the simple act of chewing your lunch feels like a monumental effort. Tasks that were easy just a few hours ago now seem almost impossible. This isn't just ordinary tiredness or the result of a poor night's sleep. It's a sudden, specific muscle weakness that gets worse the more you use your muscles, and only improves when you rest. The fatigue is unpredictable and can strike at any time, making daily life feel uncertain. After a short nap, or a brief period of rest, you might feel your strength return, almost as if nothing was wrong. But as soon as you start moving again, the weakness creeps back in, making it difficult to keep up with your normal routine. This unpredictable cycle of fluctuating weakness, feeling strong one moment and weak the next, is the hallmark of myasthenia gravis. It can make planning your day a real challenge, as you never know when your strength will fade. Myasthenia gravis can affect any voluntary muscle in your body. For some, it starts with the eyes, causing double vision or drooping eyelids. For others, it might affect the face, jaw, neck, arms, or legs, making everyday movements difficult and unpredictable. Some people notice their voice becoming soft or nasal, or find it hard to hold up their head, especially as the day goes on. Even speaking or swallowing can become a struggle, adding to the frustration and isolation. Unlike regular tiredness, this is a breakdown in the communication system between your nerves and muscles, the very system that powers every movement you make. It's not about willpower or motivation, it's a physical barrier that can't be pushed through. Recognizing this unique pattern of weakness and recovery is key to diagnosing myasthenia gravis. It often takes careful observation and communication with healthcare professionals to piece together the puzzle of symptoms. Understanding these daily struggles is essential, not just for those living with myasthenia gravis, but for their families, friends, and caregivers. With the right support and effective management, people with myasthenia gravis can regain confidence and find new ways to thrive, despite the challenges they face each day. Myasthenia gravis is a chronic autoimmune disorder that affects the way your muscles work. In this condition, your body's own defense system, which is supposed to protect you from infections and illnesses, mistakenly targets healthy parts of your body. Specifically, it attacks the vital connection between your nerves and muscles, disrupting the communication that allows you to move, speak, and even breathe with ease. Your immune system, which normally fights off harmful invaders like bacteria and viruses, becomes confused. It starts to see the junctions where nerves meet muscles as a threat, launching an attack against them. This is what makes myasthenia gravis an autoimmune disease. Your body is fighting itself by mistake. The body produces special proteins called antibodies. In myasthenia gravis, these antibodies block or destroy the muscle cell receptors that are needed for nerve signals to reach the muscles. Without these signals, your muscles can't contract properly, leading to weakness and fatigue. Imagine trying to unlock a door with the wrong key. The key just won't fit, and the door stays closed. That's what happens in myasthenia gravis. The message from the nerve can't get through to the muscle, so the muscle doesn't respond the way it should. This breakdown in communication leads to muscle weakness. It's important to know that the muscles themselves aren't diseased, and the nerves aren't damaged. The problem is at the junction where they meet, called the neuromuscular junction. Myasthenia gravis isn't contagious, so you can't catch it from someone else. It's also not directly inherited, though certain genetic factors may increase your risk. While it's a long-term condition, many people are able to manage their symptoms and lead active lives with the right treatment and support. Treatments for myasthenia gravis focus on controlling symptoms and calming the overactive immune response. This might include medications that improve nerve-to-muscle communication, drugs that suppress the immune system, or even surgical options in some cases. The severity of myasthenia gravis can vary widely. Some people experience only mild muscle weakness, perhaps just in the eyes or face, while others may have more serious symptoms that affect their ability to walk, talk, or even breathe. Understanding that myasthenia gravis is an autoimmune condition is key. It helps doctors diagnose the disease accurately and guides them in choosing the best treatment options for each individual patient. To move, your brain sends an electrical signal down a nerve to a muscle. At the neuromuscular junction, a tiny gap, the nerve releases acetylcholine, a chemical messenger. acetylcholine crosses the gap and binds to receptors on the muscle, triggering contraction. This process is instant and seamless, allowing everything from blinking to running. The system relies on uninterrupted communication, electrical signal, chemical messenger, and receptor binding. Any disruption weakens or blocks muscle contraction. In myasthenia gravis, this precise process is targeted by the immune system. That's why muscle weakness occurs. In myasthenia gravis, antibodies attack acetylcholine receptors at the neuromuscular junction. These antibodies block and destroy the receptors, so acetylcholine can't deliver its message. Imagine a parking lot where most spaces are blocked. Few cars, signals can park. Activate the muscle. Over time, fewer receptors remain, making muscles less responsive. Weakness worsens with repeated use as available receptors are quickly overwhelmed. Rest allows some recovery, but the cycle repeats. This explains the fluctuating activity-dependent weakness. The immune attack is ongoing, making the problem progressive. It's a microscopic battle that disrupts every movement. Myasthenia gravis is a chronic autoimmune disorder that affects the communication between nerves and muscles, leading to muscle weakness that can vary in severity. Recognizing the symptoms early is essential for timely intervention. The first signs often appear in the small muscles, especially those that control the eyes and eyelids. People may notice that their eyes feel unusually tired, heavy, or difficult to keep open, especially after reading or looking at screens for a while. Drooping eyelids, known as ptosis, and double vision, called diplopia, are among the most common early signs. These symptoms can come and go, sometimes worsening as the day progresses or after periods of activity. People may find themselves tilting their head or covering one eye to see more clearly. As the condition progresses, facial muscles may weaken, making it difficult to smile fully or show facial expressions. Smiles may appear lopsided, and the face can look flat or expressionless, which can affect social interactions and self-confidence. Chewing and swallowing can become tiring or even dangerous, especially during meals. Some people may cough, choke, or feel food getting stuck, increasing the risk of aspiration and making eating a stressful experience. Speech may also be affected. After talking for a while, the voice can become soft, slurred, or take on a nasal quality. This can make communication challenging, especially in social or work settings. Weakness can spread to the neck, shoulders, and hips, making everyday tasks like lifting objects, combing hair, or even sitting up straight increasingly difficult. Simple activities may require more effort and frequent breaks. One of the hallmark features of myasthenia gravis is that muscle weakness tends to worsen with activity and improve with rest. Symptoms often fluctuate throughout the day, with energy levels dropping after exertion and improving after periods of rest. Some individuals experience only eye symptoms, a form known as ocular myasthenia, while others develop generalized weakness that affects multiple muscle groups, making mobility and independence more challenging. Recognizing these patterns, especially the fluctuating nature of weakness and the specific muscles involved, is crucial for doctors to make an accurate diagnosis and begin appropriate treatment. Early detection and diagnosis of myasthenia gravis can lead to better management, more effective treatment options, and a significantly improved quality of life for those affected. Myasthenia gravis is rare but can affect anyone, though it's most common in women under 40 and men over 60. Young women are often diagnosed in their 20s and 30s, possibly due to hormonal or immune factors. Older men may be misdiagnosed as simply aging, delaying treatment. The disease isn't directly inherited, but a family history of autoimmune disorders slightly increases risk. Environmental triggers may also play a role. Rarely, mothers with myasthenia gravis can pass antibodies to newborns, causing temporary weakness. This neonatal form resolves as maternal antibodies clear. These patterns help doctors identify and treat the disease early. Diagnosis starts with a detailed history. Fluctuating weakness that worsens with activity is a key clue. Physical tests, like holding a gaze or arms outstretched, reveal fatigable weakness. The ice pack test can temporarily improve drooping eyelids, hinting at the diagnosis. Blood tests check for antibodies against acetylcholine receptors or MuSK. Most patients with generalized myasthenia test positive for these antibodies. Electrical tests, like repetitive nerve stimulation, show muscle fatigue with repeated signals. Combining symptoms, exam findings, blood work, and EMG confirms the diagnosis. Early, accurate diagnosis is essential for effective treatment. This comprehensive approach ensures patients get the right care quickly. While there's no cure, myasthenia gravis can be managed with medication, surgery, and supportive care. Cholinesterase inhibitors, like pyridostigmine, help acetylcholine work longer at the neuromuscular junction. Immunosuppressants, such as corticosteroids and other agents, reduce harmful antibody production. Thymectomy, removal of the thymus gland, can lead to improvement, especially in younger patients. For severe symptoms or crisis, rapid treatments like plasmapheresis or IVIG temporarily remove or dilute antibodies. Treatment plans are tailored to each person's symptoms and needs. The goal is to restore muscle strength and allow a full, active life. Ongoing monitoring helps adjust therapy and minimize side effects. With modern care, most people achieve good symptom control. Early intervention makes a significant difference. A diagnosis of myasthenia gravis can be overwhelming, but most people manage their symptoms and live full lives. Education and self-awareness are key. Knowing triggers and working with healthcare providers empowers patients. Energy conservation strategies like pacing activities and using assistive devices help maintain independence. Recognizing warning signs of crisis, such as trouble breathing or swallowing, is vital for safety. Emergency plans and support systems provide reassurance. Myasthenic crises are now rare and treatable with modern medicine. Ongoing research promises even better therapies ahead. Support groups offer community and shared experience. With the right management, people with myasthenia gravis can thrive and prove that strength goes beyond muscles.